Salim Has Bioethics and Professionalism program is the only program in the region that deals with matters pertaining to bioethics, medical humanism, clinical ethics. As you know, we'll be moving to ACC, and as soon as we move, there will be an announcement that the program will be a center, as I said. And part of the center, we have a library, which is the only library so far in the region, which will contain books on medical humanism, on ethics and professionalism and bioethics. Most of the books, if not all of them actually, are donated from different universities and bioethicists in the entire world. So basically UK, EU, USA. And we were hoping, and we are planning, inshallah, of naming this library after our colleague Dr. Ghassan Abu-Sitta. For a very simple reason, and I can talk as much as you want, but basically Ghassan has exemplified through his career what we mean by medical humanism, professionalism, caring for patients, compassion, empathy. He even goes far beyond just an extra mile, and his acts are supererogatory as far as patients are concerned. And remember, he puts himself in dangerous positions. He doesn't worry about his own safety, and he does not get paid for this. Actually, he leaves the clinic where he usually gets paid to do what we all consider a very humanitarian and noble thing.
I think at the heart of it lies on whether you believe that you have to do the right thing. The essence of your decision-making process is this the morally and ethically acceptable course that you need to take. And so that also goes back to the concepts that the humanism and ethics program is trying to instill. And I was fortunate enough to have role models that came across my path when I was in medical school that really changed my view of medicine and what it means to be a practicing physician. But that randomness, we're now trying to instill it in a much more institutionalized way. So it's not the randomness of have you picked up the right book that will send your career in that kind of direction. This is part of the education.
We are seeing a growing interest in this area, and providing these books for free will enhance the discipline as it is. And we will be having certain sections about Ghassan. We will be transmitting his mission of medical humanism, ethical care, compassion, empathy. And as you know, at AUBMC, we have launched a new logo, if you want, motto, if you want, playing with Einstein's formula. We transformed it, instead of E equals MC squared, to M equals EC squared, where M is medicine, E is empathy, C is care and cure. So, and this is the message that Ghassan is spreading by deeds, not only by words. And he deserves to be honored. And the best way, I think, to honor him is for him to raise new generations like him. And this is one of the purposes of the library. And we are hoping that the same people who are and were and still are enthusiastic about what Ghassan is doing would donate for the library, so that we have the best library that will be able to accept or accommodate as many people as possible to keep this legacy of humanism and medicine, not necessarily in conflict zones, everywhere, in home, in the clinic, in the hospital, alive.
The most important aspect of such a library is to drive home to medical students and nursing students who form the next generation of healthcare providers. The idea that humanism lies at the core of the provision of healthcare, be it medicine or nursing, as much as the sciences do, and that it is as important for that concept to be driven home, especially in an age where corporatization of medicine has taken over and people are expected to know more about the final bill than they are about those things that created medicine as a profession in the first place. So why a library? Library is critical as a physical space to drive home the idea to generations of students that there is no medicine without the humanistic aspect of it.